Hello, my lovely people. It's my hope you had a fantastic and wonderful weekend. It's a start of a new week, and as we promised, we are still giving you more educational bangers. We are still discussing about dehydration, which is a very important topic because this is a condition that affects almost majority of the whole world. Before we continue, I always appreciate your support and the way you guys have held my hand and made me one big family with you. It's all because of your support that this channel is where it is at the moment. So let's continue encouraging our brothers and sisters, our haters and lovers, to continue subscribing and support this channel so that we may get to the next level. Diagnosis of dehydration. Or how can you tell that somebody or a client or your patient is having dehydration or has lost lots of fluids from the body? So before beginning any tests, your doctor will go over any symptoms you have had to rule out other conditions. Before beginning any tests, your doctor will go over any symptoms you have had to rule out any other condition. After taking your medical history, your doctor will check on your vital signs. After taking your medical history, your doctor will check on your vital signs, including the heart rate, blood pressure, temperature, which may help indicate dehydration. Because, for example, if you are dehydrated, you will have fast heart rate or fast heartbeat. So your doctor may use blood test to check the level of electrolytes, which can help indicate fluid loss. For example, if you have diarrhea and vomiting, you will have electrolyte imbalance, and through a blood test, the doctor will tell whether you are dehydrated or not. Blood tests can also check body's creatinine level. Blood tests can also check body's creatinine levels, which help to determine how the kidneys are functioning, which helps to determine, which is an indicator of the degree of dehydration. As we said before, when you are dehydrated, your kidneys are more prone to kidney damage. So if you check blood for creatinine levels, this will show is the functioning of the kidney 100% or it's impaired or interfered with, which can lead to a diagnosis that you are having dehydration. Urinalysis is an examination that uses sample of urine to check the presence of bacteria and electrolyte loss. Urinalysis is an examination that uses a sample of urine to check the presence of bacteria and electrolyte loss. The color of urine can also determine or indicate dehydration when combined with other symptoms. For example, if you are dehydrated, definitely you will have dark colored urine. That means dark colored urine can be an indicator that you are dehydrated, but in combination with other symptoms, because dark urine alone can also be a manifestation of another condition. So it has to combine with other symptoms for you to come into a conclusion that this person is dehydrated. Let me repeat this, and it's a point to note. Dark urine alone can't diagnose dehydration because of what I've just explained. Let's talk about the strategies. Strategy to treat dehydration, or strategies to combat or prevent dehydration. Treatments for dehydration include rehydrating methods. Treatment for dehydration include rehydrating methods, electrolyte replacement and treating diarrhea and vomiting. Treatment for dehydration include rehydrating methods, electrolyte replacement and treating diarrhea and vomiting, which are the common causes of dehydration. If needed, possible for all people, if need be, or if possible for all people, like those who have severe diarrhea or vomiting. In this case, fluids can be given intravenously. Or if you have severe dehydration, fluid can be replaced through intravenous method, or intravenous fluid, or through the vein. For those who are able to drink or take orally, drinking water along with an electrolyte containing rehydration drink, such as low sugar sports or electrolyte drink, can help in rehydration. For those who are able to drink or take orally, drinking water along with an electrolyte containing rehydration drink, such as low sugar sports or electrolyte drink, might be recommended because they can take and retain, compared to those who can't hold any fluids. So for those who can't hold any fluid, or those who can't retain, we opt for intravenous method or through the vein. Children with dehydration should drink Pedialyte, and we have talked about this severally. So children with dehydration should take Pedialyte. Homemade rehydration solutions, and we talked about this. We talked about the combination of salt, sugar, and water. So it's always a half teaspoon of salt, 6 teaspoons of sugar added to 1 liter of water. A half teaspoon of salt, 6 teaspoons of sugar added to 1 liter of water. Note this. Be as absolutely certain you are using accurate measurements. Be absolutely certain that you are using accurate measurements. Using too much salt or sugar can be dangerous. Using too much salt or sugar can be dangerous. Another point to note, avoid soda, alcohol, overly sweet drinks, or caffeine, as they may worsen dehydration. This marks the end of our first video today, and in the next video we'll be talking about the complications of dehydration, of which I know most of them we have touched them in the previous topics when we were discussing food poisoning, vomiting, and also diarrhea. So let's meet in the next topic, in the next video, sorry.